All right, good morning, everyone. Welcome to the Wayne County Health Catalyst for COVID Care Health Literacy Training Session. Before we get started with the session, we'd like to ask you to do our pre-session evaluation. Of course, participating in this is completely voluntary, but if you'd like, you can scan the QR code, or Brittany is putting the link in the chat.
Yes, I am. I'm trying to look for the links. I thought I had it. 1 second.
Okay, we'll find it in a second.
Okay.
In the meantime, I'll pause so we can have a few minutes to do that. Oh no.
What's wrong? Is
Recording. Okay, I'm not sure if we'll have a full recording, but we'll see. Okay. So, causes of vaccine hesitancy. These are all things that we've talked about, right? Healthcare and socioeconomic inequalities and inequities. Lack of effective public health messaging or confusing public health messaging. Certainly unethical research in the history of this country involving ethnic minority groups causes a great sense of mistrust in the system. Social disadvantages, social determinants, like we discussed. The growing spread of mis, dis, and conspiracy theories through the online platforms. And then not so much in the United States, but barriers to access can be a problem, including the delivery of the vaccine. All right, Stephanie, should we wait a few more minutes? Oh, Sarah, if you're talking, you're muted.
No, I wasn't talking. I was just saying I'm not sure when she'll get back. I don't think she's feeling well.
Okay, we're going to keep going then. Okay, so there's a link to this guide. This came out in 2021, I believe, and it has different strategies for COVID-19. We're going to talk about MI and combating misinformation. So we'll start with motivational interviewing. This is just a very brief introduction to the concept. Sarah or Teresa, have you learned about motivational interviewing before? Yeah, good. Okay. And like I say every time, all of these topics are big topics. So, if you need additional information, I encourage you to follow up. There's YouTube videos galore, there's trainings galore. But we know MI is a guiding style of communication. It balances good listening with advice. And it really is designed to increase the patient motivation and likelihood of behavior change. And motivational interview is really based on a respectful and curious way of being with people. So just talking to people, right? Respecting their autonomy. So this slide shows the spirit of motivational interviewing. So we're going to compare that to kind of the traditional or authoritative, so for the longest time, doctor knows best. Doctor's the expert, patient doesn't know anything. Well, the doctor might know, right, about the medical treatments or the condition or what might help it. But the patient themselves and their family know what's going on in their own body, in their own life. So it really is a matter of asking open-ended questions and learning more about, what's going on and what motivates a person to behave the way they do. So it's collaboration, right? It's collaborating with the patient, making joint decision-making. Evocation is just, being curious, what's going on? And honoring their autonomy. We're not going to yell at you if you don't want to make this change. This is just a process to help you understand the change. Okay. So ORS is the model that I present. There's other models, of course, but ORS is a 4-step process. Starts with open-ended questions. So again, rather than saying, did you understand? Say something like, okay, tell me more about this, or how do you feel about this? Make this clear for me. How do you feel about your diabetes? Don't ask anyone that. No, I'm just kidding. Affirmations, though, recognizing and reinforcing. You want to be authentic. You want to be sincere. Something like, it takes a lot of strength to go through that. I can see that you've, gone through a lot. Reflections are mirroring what the client's saying. So again, to clarify, every time you ask a question, you may want to reflect. Every couple times you may want to reflect and say something like, so make sure I'm understanding this right, or it sounds like what you're saying, or et cetera, right? And then summarize is an opportunity to kind of go through the information again. If there was anything you didn't understand, the patient has an opportunity to kind of clarify that. And then that really can be the bridge point where you start setting those small goals, right? So this is the technique of ORS. Specifically about COVID, don't assume a person thinks the vaccine's okay, right? Don't assume vaccine hesitance. So just be very open-minded when you start talking about the vaccine. Acknowledge the concerns without judging. Don't judge anything. Judging is the worst thing you can do. Have empathy, understand where the person's coming from. Avoid criticizing information sources. A person might have received their information from someone like a church leader or an elder in their community, and we don't want to criticize that. We want to just instead provide factual, high quality information. Showing your awareness as a status as a messenger. Community health workers are so important to the community, the gel that makes up health of the community. You are an important messenger. Using trusted messengers, we know this can be helpful. And then linking the vaccine acceptance to the patient's hopes and goals. This was a lot, more towards the beginning when, remember, everyone that was older, elderly persons couldn't see their grandkids for a long time. And, one of the things that you could say is, I see how important it is for you to, reconnect with your grandkids. The vaccine will, allow you to do that. So those are just some tips, about vaccine hesitancy specifically. We will do a quick example, and then we're almost done. So Brittany and I are going to do another reenactment. The first one is the traditional approach. So this is based on the, I'm the boss, you don't know anything, I'm the expert, paternalistic. Okay, so Brittany, are you ready?
Yeah, I'm ready.
All right, so I'm the provider. It's important, Miss Reed, it's important to immunize your child. If not, you're putting him in danger. Do you know there's still cases of measles out there? That disease can be very dangerous. And what about meningitis? It can be fatal, You should update your child's vaccines as soon as possible. He's already late according to schedule. Let's do that now.
I don't see the urgency, and autism is worse than measles. There are more problems than solutions with this vaccine. And it's just completely unbelievable to give so many vaccines at the same time.
Studies have demonstrated there's no link between autism and measles. The vaccine is safe, I assure you. You should be aware of the information you're finding on the internet. Giving several vaccines at the same time is safe and not associated with more pain. We should update his vaccines now.
I've heard something else, and not only on the internet, I read a lot, and vaccinations is not mandatory. I can do what I want. It's my child.
You're right, it's not mandatory, but you're putting him and other children who can't receive vaccines in danger. The risk of the disease is much higher than the risk of the vaccine. If I'm taking this time to talk to you about it, it's because it's very important.
That's easy for you to say, but what if he gets autism? I'm worried about the risk of the vaccines, but you don't seem to be worried about my child or his health at all.
Of course I am. And I'm worried about the fact that he could get diseases that can be prevented by the vaccines.
I think we just don't understand each other. Let's talk about this another time.
Okay, so in this example, I'm kind of telling her what she needs to do, and she's becoming more and more resistant to it. So let's do a motivational type interviewing approach. So I walk in. Okay, hi, Miss Reed. What do you think about the advantages of vaccination?
Well, I know the vaccines protect children against several diseases that we don't see anymore. My child received all of his first vaccines, but I'm worried that the measles vaccine could cause autism. For other vaccines, I have fewer doubts, but I'm still hesitating.
As you said, vaccines have reduced diseases in such an important way that they're now much less frequent. That's why you vaccinated your child when he was a baby. If I understood you correctly, with the exception of the measles vaccine, other vaccines seem safe to you?
Yes, I know it's a good thing to prevent those infections, but about measles, I'm conflicted. I've read a lot of books and articles, and lots of people are worried about the link between the measles vaccine and autism.
So you find it's important to protect your child against diseases when the vaccines are safe, but you're worried about what will happen regarding autism and measles vaccine. I see that you've done a lot of research on the subject. If you'd like, I can give you some additional information about that study with measles and autism.
Sure, I want to know exactly what happened.
In fact, you're right. One study had shown a link between measles vaccine and autism, but the study was fake and the author lost his medical license. More than 500 additional studies around the world have shown there's no link between the vaccine and autism. The frequency of autism is the same in a vaccinated group of children than it is in a non-vaccinated group. What do you think?
Well, so I'm glad I'm not crazy to be worried about that.
So no, you're not crazy at all. You're totally right.
Well, thank you for taking the time to understand my concerns. I think it's a bit clearer now for me.
Okay. So in this example, I asked open-ended questions that elicited that she, felt a certain way about a very specific vaccine. It wasn't all vaccines. And then I was able to give her some information that she was agreeable to hear. And those things, lead to her actually thinking about providing the vaccine to her child. So that's a really quick, role-playing version of the two, but just to kind of go through motivational interviewing. Our last thing is combating mis and disinformation. Who knows the difference between mis and disinformation? Teresa?
I might have an idea. So like misinformation, would it be like obviously not providing like true and like accurate information, and then disinformation like leaving out information that could potentially be important?
That's a good thought, but it's pretty close.
Okay.
So in both cases, the information is not true, it's false. Misinformation is shared unknowingly, like someone doesn't realize what they're sharing is not true. Disinformation is purposefully put out false information. So there you go. Teresa, look at your face. Okay. So you guys know social media is huge. This slide just shows all the different things that we can get information on in today's age. So it's no wonder that we have misinformation. So some of the strategies, again, like I said before, don't argue against mis or disinformation, just provide factual, easy to understand information. Don't judge or argue. Use credible sources to demonstrate facts. And then again, the idea of the trusted messengers, which you all are. But we saw over the pandemic, and we will continue to use these strategies of using people who are well-known or maybe faith-based leaders or neighborhood champions. All right, time to wake up, everyone. So we're going to do a quick quiz about factual information about COVID-19 vaccination. So the first question, and these are kind of silly, but what is the recommended COVID vaccine regimen right now? So there's 5 choices. So we have 2 doses of with Omicron BA.4. We have 1 dose of Omicron BA.4. We have 2 doses of XBB Omicron. We have 1 dose, and then we have Janssen. So which one can we definitely eliminate? It's E. No one's using Janssen anymore, just so everyone knows.
I thought it was Johnson.
You know what? It's Johnson & Johnson, aka Janssen. It's a
Okay.
different way. Yeah.
Yeah.
So the answer is this is the new booster, and I'm going to show you the vaccines. Originally, we had the monovalent series, which was the Delta strain, and that was the first round that went out. Then we had that booster, and that first booster covered BA.4 and BA.5, specifically for Omicron. Now we have these 2, This is Pfizer is this Comirnaty, I can't say it. And then Moderna is the Spikevax. And these are the current strains that they formulated against. All right. And basically they're recommending everyone gets one booster vaccine regardless of where you've been. But there are some subgroups that have different schedules, so keep that in mind. So in March of 2023, people had what compared, so if you had the updated booster, what was your risk compared to people that were unvaccinated of death? Anyone want to take a stab at it?
Would it be A?
It is A. So again, the CDC stopped publishing this data, but they were publishing it up through April of this year. You can still get it. It's just not in this super nice format anymore. But we can see, you know, here is COVID deaths, and the blue line is vaccinated. The green line is the Omicron boosted. And then even the rate of cases, of course, was higher in people that were unvaccinated than vaccinated. All right, and this one's just a pimp question, so I'm going to just read it to you. So the new Pfizer and Moderna boosters cover what? They cover all of these except for, remember, BA4, BA5, and Delta were the first three original strains that were covered.
And that's because those strains are less prevalent now?
Yes,
Okay.
it's mutated way out of this.
Okay, awesome.
Not way, but I like to exaggerate mutation. It continues to mutate. All right, so kind of to wrap it up here, the last interactive component, did anyone have any experiences with people who are refusing to get vaccinated, either because of mis or disinformation? Stephanie?
Not necessarily, I think, because of that. I kind of refused to get it until the very last minute before they fired me.
Okay. And what?
I don't know, like I read both reports on the vaccine, and to me, I felt like there wasn't like enough information to me in my eyes personally.
Mhm.
So
But
yeah.
you ended up getting it.
Yeah, every job required it, so I had to get it.
Okay. So you were obligated to get it.
Yeah.
Sarah?
So this wasn't the COVID vaccine, but sort of back to my example earlier, it's actually mainly specifically vaccines that my family are reluctant to get, and will go and talk to my mom about it. And I think it's mainly a trust issue. They don't trust their doctors to give them correct information, but they trust my mom, even though she's giving the exact same information. And so I think there's some fear, especially about the COVID vaccine. I've heard people who are reluctant to get it don't want the negative side effects. There are some people who like it knocks them out for a couple days.
Mhm.
And there are others who don't have any really negative symptoms. For me, I got sort of a slight headache and some like body aches similar to what you get when you have like a cold. But yeah, I think there's the sort of variety in symptoms that people will experience, where there's like some fear or some like I don't want to miss work because of this. Actually, my dad hasn't gotten vaccinated, even though he's a physician, because he doesn't want to miss work because of it. So yeah, I think there's a wide variety of reasons.
Yeah. Has anyone heard, you know, that the vaccine will implant a chip? They'll be able to monitor. Yeah. So there's a lot of, go ahead, Teresa.
When like the whole thing of the vaccines first came out, everybody kept telling me that, and I was like super afraid. I was like, I don't want to get it, and so I refused to get it for a while, and then just like Stephanie, I had to get it because if not, I wouldn't get the job. And so I'm like, well, it won't be too bad if it is true. So I just did it anyway.
So one of the co-presenters before Maya, she said her daughter, who's 17, was convinced that they would get some superpower or some sort of mutant thing would happen. But that's what happens when we have misinformation, being spread widespread. It's interesting because I really understand and respect, like Stephanie and Teresa, what you were saying. It was new, right? And we were kind of forced to get it. It's an interesting topic, Stephanie.
Yeah, I don't know. I mean, like with other vaccines, they took like years to develop, And then with this one, I don't know, just out of the blue. Not out of the blue, right? Because like people worked on it and stuff like that. But to like, because I don't think it was like FDA approved, right? Or something. Not FDA. It wasn't CDC approved, right?
Well, it's for
Like straight off the
emergency use.
bat. Because it was, yeah. I don't know. I don't know.
So,
I got it. I'm alive.
I
yeah.
kind of like remember when they first like, right, same. When they first like released it, my father-in-law had gotten like a letter in the mail saying like, hey, like, obviously we need it, like we came up with the vaccine so soon that we still need to like test trial it, And so like the first people to like come and get the vaccine, like we'll give you this much money. And we were like, so guinea pigs, like no. So it was kind of like let whoever wants to try it, and then we'll go.
Yeah. Yeah.
But also too, like I think like my biggest thing, and this is coming like culturally, my mom has always like taught me that like naturally and like doing things naturally and herbs and all this stuff could like help you instead of just like going straight to like medication. So like vaccines and stuff, I've always gotten them and I'm like up to date with everything, but like it's always been like a like topic for me just because like even if the CDC were to like release like, hey, yeah, it's safe, like I don't know, there's like a trust issue in me where it's like, well, how do they know? And it just goes back to like, well, why can't you just find something natural?
I think also for me, it's interesting having had two parents who are doctors because there was kind of this assumption growing up that like anything health related, what they say goes.
Mhm.
And so I wasn't really encouraged to challenge that or ask questions. Because it was always like, oh, well, mom's an ER doc, so she knows best, sort of. And like, so I when I was little, couldn't tell you if I had ever questioned or wanted to question because there was just sort of this assumption that you don't question the professional. And mom is the professional, so she's going to make those decisions. So sort of on the other end of the spectrum, like I didn't really, there was almost like I didn't get a choice and I didn't get the chance to ask those questions because it was like, oh, well, mom knows.
Mhm.
And so it doesn't matter if, Sarah has questions or concerns. And then it was only later, taking more advanced biology classes, and I took an immunology class last semester that I like feel like I completely understand like the concept of vaccines, but then there's still questions about like, oh, well, how do I know, exactly what's in the vaccine? I know the idea of the vaccine, but then, there are all these other complicated things going on. So I think, at least for me, that can potentially increase my empathy towards somebody who is questioning the vaccine. Because at this point, I don't feel like I would, but I also haven't had any of those really bad side effects where like I've had to take time off of school or work because of one of the vaccines.
Mhm.
Or, I haven't been surrounded by people telling me that like the government is going to implant a chip and they're going to like have surveillance over me. So I didn't have that, fear going into it. But yeah, like I said, I think understanding that and talking through that with patients increases my empathy and understanding for them, which then hopefully they can see that and it'll affect the interaction and the discussion that we might have if that situation ever comes up.
Thank you for sharing. Yeah, you kind of demonstrated the entire lecture in those two comments. So that was really good. Okay. So that's it. I'm gonna give it over to Brandy to wrap us up.
All right. In summary, here are some key takeaways. Low health literacy is associated with lower health knowledge, poor medication adherence, increased use of ERs for primary care, and increased mortality rates, all which impact the quality of life. All of these are impacts of low health literacy. And it's important to use universal precautions and assume all patients have a low health literacy level. Improving individual and community health literacy levels can also reduce vaccine hesitancy and increase COVID-19 rates. And the recommended grade level for written materials is 5th to 6th grade. And health literacy strategies can be used to increase patients' understanding about their health condition, empowering them to take an active role in their own health. And we can do this by clear communication, teach back using linguistically and culturally appropriate materials, and motivational interviewing, and combating misinformation.
All right. Thanks, Brandy.
Mm-hmm.
So you'll get a copy of the slides. If you have any questions, you can email me. I'll come right back to this, but there is an additional training here for the CDC if you want more information on health literacy. And here's a slide with all the resources that we used. And there's an article on tiny habits as well, which is kind of cool. So with that being said, thank you all for participating today. It was a really good discussion, and I appreciate that you all gave that feedback. If you would like to, this is an opportunity to do the post-session evaluation. Hold on one second. I'm so sorry. Hold on. Okay, there is a there's a certificate that you can receive. You can also get your MISHWA 2.0 hours, but you can also get a certificate of completion from Wayne County Community College District. So if you would like that, you have to fill out the whole form. So you'll see at the end of the quiz, there's a section to evaluate the quality of our presentation, as well as provide your name, your birth date, etc. They do register you as a full student in the continuing education program, so that's why they ask you for things like your name and address and whatnot. Okay. Yeah. All right.
Thank you.
That is my son calling, so I do apologize.
All right.
Thank you.